an insurance company might actually say, we're not going to cover that. And it's really important for people to understand that they don't have to take no for an answer.
Thank you so much, Joanna, for joining me today and speaking about what to do if insurance companies say no. So, first, in what instances might insurance companies say no to patients with cancer?
It's actually pretty common at some point during a cancer experience for an insurance company to come back and say, we aren't going to cover something. It might be coverage for a screening. It might be coverage for diagnostic testing. It might be coverage for genetic testing or treatment or a prescription drug. So there's lots of different types of treatment that someone might be needing where an insurance company might actually say, we're not going to cover that. And it's really important for people to understand that they don't have to take no for an answer and that they can actually appeal those denials of coverage. So if somebody has private insurance, for example, they have access to both an internal appeal, where you go back to the insurance company and say, will you reconsider? Will you take a look at this again? And if an insurance company says no to the internal appeal, they also have the right to an external appeal, where you get to go outside the insurance company to see if that external independent entity thinks that it's medically necessary for you to get access to that care that's prescribed by your healthcare team. So that's a really valuable consumer protection, but unfortunately, no one knows about that external appeal right. In fact, 99.9% of people who experience denials of coverage don't appeal even to the first level of appeal. And so this is where the advocacy community fought hard for consumer protection, but no one actually knows about the protection. And so they're not getting to take advantage of that benefit. And about 50% of the time, if someone does file an external appeal, they're actually successful. So it's one of those protections that actually works in favor of patients if they know about it.
Excellent. Great points there. And for patients or even their caregivers who do want to make that appeal, what is the first step they should really take?
Well, the first thing that anyone needs to do when considering an appeal after being denied by an insurance company is to figure out what type of insurance they have, because the process for appealing is different based on the type of insurance. So I just mentioned private insurance, but if you have Medicare or Medicaid, for example, there are rights to appeal, but the actual steps that you take are different. And so that's really the first thing that you have to do is figure out what type of insurance you have, and then to understand the steps specific to that type of insurance.
Good. And what are ways that patients and caregivers can continue to advocate for themselves during this tricky time?
Well, I think it's a great time to engage family members and friends when not the appeals process, because it does sometimes require paperwork and making sure that you're gathering information from your healthcare team about why the care that you're receiving is medically necessary, and then compiling that information and sending it in the appeal to the insurance company. So that's a great time to ask family members and friends to actually help you with that process. I think also it can feel daunting when you're trying to go up against an insurance company to make sure that you're getting access to the care that you need. It's also a great time to talk to your healthcare team, because sometimes healthcare providers will actually file those appeals for you and you don't even know it's happening. So there are lots of providers that do it for you. But if you're in a situation where you have to file the appeal, they are a great partner in this process, because obviously your healthcare team thinks that you should get access to treatment for a specific reason. So they really have the evidence for why the care that you're getting is medically necessary. So they can provide you with the guidelines that show that that particular treatment is appropriate. They can share with you research studies that have shown the value of that treatment. So they're really a great partner in being able to provide that information to show that it's medically necessary.
Very important. And what are some ways that Triage Cancer can help with this?
So Triage Cancer feels very strongly that people should understand their rights to appeal because we think it's one of the best kept secrets of the healthcare system. And it's key to not only making sure that patients get access to the care that they need, but that they don't end up either not getting access to care or they pay for that care out of pocket when it should have been covered by insurance, because that contributes to the financial hardship of a serious medical condition like cancer. So we feel strongly that people should understand their rights to appeal. So we have a lot of resources to help people understand those rights. And that includes print materials that people can find on our website or order copies of. It includes our Cancer Finances Toolkit, which has a section on appeals. And when you go to that online toolkit, you pick the type of insurance that you have, and then it gives you those step-by-step instructions on how to pursue the appeals process based on the type of insurance that you have. And then if you still need help, we also have our legal and financial navigation program where people can contact us with their questions about navigating insurance coverage, like the appeals process.
Awesome, very helpful. And what other advice would you offer to patients during this time when an insurance company does say no?
I think it's important to remember that you do have rights. And at the end of the day, you want to make sure that you're getting access to the care that your healthcare team thinks is important for you to get access to. And so it does require some steps to the process and making sure that you're actually getting that appeal filed. But as I mentioned, people are very successful when they actually go through the appeals process. So it's worth it in the end.